We all know that doctors are among the most compassionate and kind-hearted people because of their noble work in alleviating people's pain and treating their illnesses. However, let's not forget that doctors are human beings, and it's possible for some patients to become victims at the hands of a doctor who is disturbed or insane. Doctors are not immune to madness or mental instability. Today, we have a different type of doctors, the kind that has shifted the balance and transformed the doctor from an angel of mercy into a heartless butcher, to say the least. The hero of our story is Harold Sheffman, born in January 1946 in Britain. He is the middle child in a family consisting of a mother, father, and 3 siblings. Contrary to what you might expect based on the stories I mentioned earlier, when a person transforms from a normal human being to a killer, they usually have a dark childhood past. However, Harold was not like that. On the contrary, he grew up in a stable and religious family, so his early childhood was not difficult. Despite the challenging financial circumstances his family faced, Harold's mother always took care of him and supported him in everything he did. He was known as an intelligent and outstanding child in his studies. He also had a passion for sports, particularly running. This passion led him to participate in youth championships, where he excelled and won numerous awards. Harold was unusually close to his mother and had an intense attachment to her, to the point of obsession. His mother was the person who encouraged and supported him the most. Up until this point, Harold's life was almost ideal. However, when he turned 17, everything changed drastically. Harold learned about his mother's lung cancer diagnosis, and during her illness, he became even closer to her, constantly monitoring her condition. It was during this time that Harold started focusing on the doctors and the medications they were administering to his mother. He discovered that the doctors were injecting her with doses of morphine, almost daily, and he noticed how the morphine inhabits her pain even in her final stages. In 1963, on July 21st, his mother passed away, leaving Harold in a state of profound shock and with numerous unanswered questions swirling in his mind. How could morphine relieve her pain to such an extent? And why wasn't this substance capable of saving her life? Anyway, Harold managed to overcome his mother's death and decided to continue his life and pursue his dream of becoming a doctor. He successfully enrolled in medical school, and during his studies, he met the girl who would eventually become his wife. She was his classmate, Primrose, and they got married before he finished his university education. They went on to have 4 children together. Harold graduated from medical school with honors. Given the opportunity to practice medicine and satisfy his curiosity about many things, he might think that Harold had forgotten about his mother's death, especially after getting married and starting a family. However, in reality, Harold never completely forgot about his mother. He remembered every detail about her and was determined to discover many things on his own. No one knew exactly what he was thinking. In the first year after graduating from university, Harold's crimes began. It all started during his internship before he became a fully fledged doctor. When Harold was working at a hospital, a patient died due to a severe deterioration in his condition. Since Harold was a trainee doctor at that time, nobody suspected him at all. The matter was closed, and Harold felt secure. He believed that no matter what he did, nobody would discover his actions. It was from this point that he began to devise his sinister plans. Afterward, Harold started to discover a substance that was unknown to him, which was morphine. He decided to try it himself because he observed that when doctors administered it to his mother, she experienced relief. So he made the initial decision to forge medical prescriptions for himself, stating that he needed this medication. From there, he became addicted to morphine and its derivatives, as they are essentially the same as drugs. As you know, addiction exposes its owner. After a short period of being addicted to this type of medication, doctors started noticing something strange about him, such as lack of concentration and peculiar behavior. His fellow doctors advised him to quit this behavior and assured him that they would help him overcome the addiction. However, Harold refused their advice. His colleagues attempted multiple times to assist him, but he did not respond to them. Day by day, they became increasingly frustrated with his behavior towards them. so they decided to report him. After reporting him, he was dismissed from his job and fined £600 for the charge of forging medical prescriptions. Afterward, he entered a center for addiction treatment and psychological therapy, and Harold remained there, receiving the necessary care and support. After completing his treatment, he was discharged from the hospital. However, despite reports stating that Harold was receiving treatment, he was not actually being treated properly, as his dark thoughts persisted in his mind. After his financial situation improved and his affairs stabilized, he decided to open his own clinic, exclusively for himself. It is from here that his series of crimes began, targeting and killing patients, but certainly not in his own clinic. Harold eventually returned to work, and over the years, he gained the trust of everyone around him. Everyone believed that Harold felt guilty, but no one knew that he was planning the largest massacre in the history of Britain. Harold would inject his patients with extremely high doses of morphine and would list the cause of death as natural or due to deteriorating health conditions. Due to his good reputation and his intelligence, no one suspected him. He carefully selected his victims, choosing elderly individuals who mostly lived alone, without anyone to inquire about them. This worked in his favor. The deaths of elderly and sick individuals wouldn't raise any suspicions. But why did Harold do this? That's the question. After killing his victims, Harold would write their wills, indicating that large sums of money were to be left to him. It was as if the patient had registered a will, stating that this money was intended for Harold. It was an incredibly disgusting and inhumane act. Harold continued with this scenario for 20 years. Can you imagine? 20 years? No one caught him, and hardly a month passed without him killing at least one person, if not more. And no one knew that all those poor patients had died at the hands of a mentally disturbed doctor. As time went on, people began to notice an increase in the number of deaths, especially among the patients Harold visited. The person responsible for burial services in the area also noticed that the victims had similarities in the cause of death. They had all died in a seemingly natural manner, and the majority of them were elderly women. This person decided to visit Harold and ask him about the reasons behind these deaths. However, Harold managed to convince them that all the deaths were natural, and that most of the patients were suffering from various illnesses. But then, a doctor noticed a significant rise in the number of deaths and decided to report it to the police. Here, suspicions grew stronger around Harold, but unfortunately the police couldn't accuse him of anything, especially after he had gained people's trust. As I mentioned before, he continued his activities for a period of 20 years without anyone knowing about his crimes or how he was killing the patients. Despite the police intensifying their investigation into the cause of the deaths, Harold continued to kill patients in the same manner and showed no fear of being caught. However, he eventually committed his decisive crime. One day, his last victim was an elderly woman named Kathleen Grandy. Her daughter, Angela, visited her at the hospital. After ensuring her mother's is okay, Angela returned home. However, strangely enough, only a few hours later, she received a call informing her that her mother had passed away. At that moment, Angela couldn't think in right way as she was overwhelmed with grief over her mother's death. She went to the hospital to collect her mother's body, and that's when she made a shocking discovery. Her mother had written in her will that she would leave £386,000 to Dr. Harold. Angela was taken aback and said, "My mother could never have written this and given such a large amount to Dr. Harold." She had never seen him in her mother's life except when she entered the hospital. Something was so weird. Angela decided to report this to the police and requested that they investigate the matter. Initially, the police didn't pay much attention, but Angela insisted that there was confusion surrounding the situation. She was convinced that something had happened that no one knew about. The police began to investigate Harold and questioned him about Kathleen's condition and the cause of her death. Upon reviewing Kathleen's case, it became clear that she didn't need morphine at all. After conducting an autopsy, they discovered high levels of morphine in Kathleen's blood. Initially, Harold denied any involvement, and claimed that he administered morphine because she was addicted to it, and it had nothing to do with him. However, during the investigation and questioning of Angela, they found out that Kathleen was not addicted to morphine at all, and her health was excellent. When she entered the hospital, she only had some minor pain, but there were no underlying illnesses. The investigation continued for 2 years, and during this time, the police were able to uncover that Harold was responsible for the deaths of 250 individuals. All of his victims were patients, and he killed them using morphine. Unfortunately, they could only prove him guilty of 15 crimes, and all of them were elderly individuals. 80% of the victims were women, and the youngest victim was a 41-year-old man. They were all killed using the same method, with morphine. In the year 2000, after 15 cases of murder and document forgery were proven against Harold, these charges led to his imprisonment for life, without any chance of parole. The strange thing is that Harold insisted on his innocence until his last breath. He always challenged the scientific evidence, and his wife, Prime, also insisted on his innocence even after his conviction. She remained a believer in Harold's innocence despite all the evidence against him. After Harold entered prison, he received a message from his wife saying, "Tell me everything, regardless of the reason." However, even though he had been sentenced to life, he persisted and told her, "I am innocent." It's incredible to imagine that even his own wife was unaware that he was responsible for the deaths of 250 people. He managed to conceal that from the closest people to him. On January 13, 2004, which happened to be his 58th birthday, the prison guard entered Harold's cell to give him dinner, only to discover that Harold had hanged himself with a bedsheet. This ending brought relief to many of the victims' families, but some did not feel a sense of. The families of the victims had hoped that Harold would at least confess, and they did not see it as his right to end his own life after he had prematurely ended the lives of so many people against their will. In the end, the world was permanently rid of this doctor. Harold Shipman is the only physician in the history of Britain who took pleasure in killing such an immense number of patients. He deserves the title of Death Doctor. No one knew his motives towards the crimes. It is possible that they were due to a psychological trauma from his mother's death, or it could be because of his greed for the patient's money. No one knows for sure. Harold has died, and his reasons were buried with him. However, we all agree that he broke the record for serial killers, which is a disturbing fact, and the most unsettling aspect is his lack of remorse for his actions. I appreciate your support through likes and subscriptions to the channel. Please let me know what story you would like me to discuss in the upcoming video. I'm looking forward to your suggestions.